Welcome to Oncology Unscripted. My name is Matt Spraker, a radiation oncologist in Denver, Colorado.
My name is Katie Coleman. I am a kidney cancer patient and patient advocate in Austin, Texas.
And my name is Julie Johnson, and I am a sarcoma patient and patient advocate in St. Louis, Missouri.
We're teaming up to meet in the middle for a candid and educational podcast about cancer that is intended for patients, doctors, and their teams. This show and our opinions are meant for general informational purposes and are not medical advice. We encourage you to reach out to your doctors to discuss your individual case. Thanks for listening. Now let's get on with the show. So I think we're gonna record about ChatGPT today. Is that right?
Yeah. Are we kicking off the episode?
Yeah, because we have an intro, so we don't have to. We recorded the intro part, so we can just dive in every week. We don't have to worry about introducing ourselves anymore. We should do that on another show. Actually, it's very efficient. Well, so I think Julie made an outline that I liked. I think it's really good. So we wanted to start, I think, by talking about so Chat CPG. I always get the letters wrong. I think
GPT.
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 What does it stand for?
It's ChatGPT. It's general. I don't know. It's a language model. I should know this, what it stands for.
Well, this is good because our first topic was what is it? So I think this is a good place to start. So I actually know a little bit about this stuff because I think Chat
GPT
falls under the big bucket of what people call AI or artificial intelligence. This stuff's been around in medicine for a long time. So when you both brought this topic up, I was excited because I used to do like machine learning research. I was not a coder or a mathematician that did this myself. I worked with a team, but I always artificial intelligence applications has been around a long time in medicine, but it finally feels like it's crossing over into like lay medicine people. In other words, like with this instance, I saw a lot of people talking about how you could just like use it day to day. And then what got me really excited is you brought up how you're using it as a patient, which I think is fascinating. And I think that's what will be most interesting for our entire audience to hear, both patients, how they can potentially use it. And then I think, doctors always are afraid of this kind of stuff, and we want to know like how it's going to start impacting our practice. And so it'd be good to kind of talk about that stuff too.
Yeah, I'm curious. You mentioned that it's, things like this have been around in medicine for a while. Can you tell me more about that? Like, how is it being used in medicine now in ways that patients maybe aren't familiar with? Yeah,
I think what's a really good point to probably make at the top, and I bet Katie, you can probably explain this better than any of us because you sort of work in you're a coder, right? We talked about how to name what your job is, but basically, people don't realize that artificial intelligence to some extent has been used for a while in different aspects of medicine, and there's some like really easy examples. So one of them I can think of that's been around for a long time is when a doctor orders a scan in the primary care setting. So like you just come in, they're like, what brings you in today? And then you have to like order tests to try to work that up. There's been tools around for several years that are inside the chart that will tell you the appropriateness of whether you should be ordering that test or not. I don't think every doctor has that, but I remember seeing that in development and being deployed as long as like 7 or 8 years ago when I was like kind of doing some volunteer work with the ACR and stuff. And so that's like an example where it takes information that you have in the chart and then it spits out like a grade, like a letter grade about how appropriate your recommendation is. And it tries to steer you to or away ordering specific tests. The classic example is like, don't order an MRI for back pain on the first day, like that kind of a thing, to try to have more meaningful use of testing. There's other things as well. Like one of the classic, one of my like nerdy hobbies that I like is design and medicine. And there's all this writing for many decades about safety and how things are designed to promote safety. One really nice use of I think probably simple kind of artificial intelligence is like when you order a medicine, you might see doctors making fun of this on Twitter, but when you order a medicine to send to the pharmacy, it'll pop up an alert if it interacts with things or if the patient's labs reflect that they might have a problem. It'll just pop up an alert and say, hey, did you know? And, it does it so often that a lot of times you get alert fatigue and you kind of just click them away. But that's another way that you can prevent If I worked 30, 40 years ago, it would require a pharmacist to call you and say, these two things interact. You shouldn't be putting them together. Whereas now a computer can kind of do it. Those are really simple things. Obviously, this new one is like way more advanced, and these large language models, right? I believe that's what they're called, are like, is a big advancement. And then now it's kind of like lay people are playing with it in the medical sense. And I think it's sort of interesting.
Yeah. So should we kind of zoom out a little bit and kind of talk about what it is overall, for people that might not know? So I pulled up what does ChatGPT stand for? Which, by the way, I like when I first started saying that, I would always say ChatGTP over and over again. So if that comes out, it's just hard to say, as we've established. But so it stands for Chat Generative Pre-trained Transformer. Basically, it's just like a chat bot that can process natural human language. So you can just ask it questions. Like, you might already be typing something into Google and you type that in the form of a question, but Google can only kind of keyword match on some of that stuff. And what the language model does is it has the ability to process that information to be able to kind of return results based on, like, as if you were just chatting with it. And so it's being used for all kinds of different things. Like, so I use it for programming, like in my own personal projects. I've used a lot in programming, but it can be used for a ton of different things. There's some people that have been using it for like building nutrition plans. And so you can kind of ask it anything. I think we'll get in the later in the episode to probably some of the cautions around using it, because one of the biggest cautions I'll say in using it is that it can be wrong, and it can be like very convincingly wrong, to where you don't know that it's wrong and it will straight up lie to you. So I think it's really important to like verify outside of ChatGPT if you can, anything that you get. And especially, I think that's why it's especially careful around like medical scenarios, to make sure that you're getting the correct information.
I think it's funny that just one of the things that I've personally observed that's been funny is there's all this fear around people using this model or this software and getting these like very confidently wrong answers. But there's a classic joke in medicine that, like, you know, doctors are often very confidently wrong about things. And I just think it's kind of rich that we're now like, it's all kind of coming full circle, where like, you know, maybe we should reflect a little if we start worrying about people using software to get answers to questions and things like that.
I think though, like there's a different level, in my opinion. Like, I totally understand what you're saying, but I think like we understand humans as flawed.
Right.
And so there's like a natural, like, oh, you can be wrong about something. There's no way you could know all of this. Whereas like Chat GPT is trained, and like a lot of people assume like, oh, you've got all of the data to process, so you're going to be right. Which like, so I'll just throw out an example of a time that it was wrong the other day. The other day I was like looking through research papers, and I was trying to figure out, I saw the name of a mouse model, and I was trying to figure out what the origin, like what kind of patient it came from, what type of cancer they had. And so I asked if it could help me find the paper or help me find like who the patient was behind the mouse model, to like, not the patient specifically, but the details on what the model was created from. And it told me that it knew exactly what it was. So I had looked it up, and it told me that it was a model for chromophobe kidney cancer. And it gave me very specific details of like, this is a 46-year-old patient, or actually not chromophobe. It said this is like a 46-year-old patient with papillary renal cell carcinoma. And that's what this model was derived from, which it wasn't at all. It was a chromophobe kidney cancer model, derived from a completely different patient. And so it completely made that up. And it's done that to me a couple of times. And so I think that's where I think there's a little bit of caution, because humans can be wrong about those things, but like I think people are expecting, like when you're typing an answer in and it's going to search all the data, if it's actually feeding you back data, like it can very confidently say what it thinks it is, and it can be wrong oftentimes.
Yeah. No, I think it's a great point about the like the way people view humans versus computers, right? And that's going to be I think it's going to be a big issue going forward, and probably our, I guess not to get too high level, but I guess our society will have to learn a little bit how to interact with these things because it's not going to go away. Part of what's amazing to me is how good it is today. And like, how fast everything moves forward. And I have a long practice ahead of me. And so it's like hard for me to even imagine how I'm going to be using this stuff in 10 or 15 years, but to say it's not going to be part of our practice is probably naive. And so it's cool we're talking about it, I think, because it'll definitely be out there.
Yeah, I think this is going to be just like people interact with Google or any other resource. I think it's going to be a resource that people learn to interact with and apply in their job. It's just figuring out how we learn to work with it. I think we're in that like infancy stage where we're all trying to figure out how the best way is to use it. And then as it refines over time and gets better, because it's stepped up a lot. Even ChatGPT 4 is a lot better than ChatGPT 3.5. And that was a pretty quick jump in the differences there. So I don't know if we want to do we want to dive into the questions or the challenges that we were going to give it as an example?
Well, maybe we can talk a little bit about how you have used it. Didn't you tweet something about some questions around it? Around how you're using it, or maybe how other patients are using it?
So I used it the other day. This one was just out of pure curiosity. So there was a paper that came out that was trying to compare if people preferred answers that came out of ChatGPT for their medical questions versus questions that came out of Reddit. There's a subreddit called Ask Docs where people can kind of post their questions and doctors can reply kind of in this anonymous fashion. Yeah. And when I saw that paper, I found it fascinating because I think it was, don't quote me on it, I don't have the paper pulled up, but it was like, I want to say it was like 70% of people, it was the majority of people preferred the ChatGPT answer. And what struck me about that and why I was so curious about it is because before I was diagnosed, like it took me a year and a half and kind of I was bumbling around the system trying to get diagnosed for a long time. I was starting to get really desperate. And the week before I got diagnosed, I was actually asking questions in Ask Docs. I was giving my like full symptoms and asking, could this be cancer? Do high platelets always mean cancer? And just like, it was very weird to go back and read those subreddit threads after I realized I was diagnosed with cancer like a week later. And so I was curious how ChatGPT would have handled the situation, because when I asked my questions to it, the doctors that had answered me were, they very much thought I was being a hypochondriac. I was told to basically seek therapy, like that if no other doctors were concerned, they probably weren't concerned, but I really should look into getting my anxiety treated and possibly into like therapy for it. And so I was curious if I asked the same questions to ChatGPT, what it would have said. And I wish I had it pulled up here, the exact thread that I had, but basically I had the exact same preference. I put the same questions and I put the same symptoms and everything all into one thing, into ChatGPT, asked it what it thought. And basically it said like, there could be a number of reasons that you're having this. It's not always cancer, but it's stressed at the bottom for me to keep pursuing. And basically like, your body, make sure you advocate for yourself, make sure you follow up with a provider. And then it said something about like, if you don't feel like your current provider is taking you seriously, like seek another one essentially, which was the opposite advice that I had gotten essentially in Ask Docs.
And I think another interesting thing about it is that the answers tend to be somewhat empathetic, which is really, a couple of minutes ago, Katie, you were talking about how, people will probably use this a lot like they use Google. But I think there's an interesting difference in that, when I Google something, I expect to get 2 million search results that I have to flip through and make sense of. But when I ask ChatGPT, like I expect to get one answer. Now we know that maybe there's some issue with the answer, but I expect to get one answer, and the answers are really thorough. It does a really nice job of not only answering the question that was asked, but also kind of backing up a couple of steps and making sure that it outlines, whether it's a term that's used in the question, the definition of the term, and then always, I feel like it always, if you're using it for medical purposes, for sure, it'll give you the caution to seek advice from a trained physician. And then the other thing that I have just personally found interesting about it versus the other ways that we find information is that, with Google or other search engines, you kind of ask a question and you get, it's like a very much of a question answer. But I have asked, this is a non-medical example, but I don't know, I think my mind could see the application in a completely different way in a medical setting. But like, I've asked it to build, you talked about it building nutrition plans. Well, I've got 4 kids. Everybody eats and likes different things. So I had my kids fill out like a checklist of all the foods they liked. And then I put all of those foods into ChatGPT and I said, make me lunch menus for the summer, and I need 15 of them. And it just spit it out. And so within a matter of minutes, I had like a plan, not just 2 million search results, but I had like tangible things that I could just go execute. And so you think about when it can, just the things that it can do that are so different than what we're used to digital tools doing for us today is pretty incredible.
Yeah. When you know the like inputs that you're putting into it and you're just basically like having it consolidate something that would have taken you an hour to do.
Yes.
It is very quick at doing those things. I use that a lot in like programming myself, like in my own personal projects. Like you can write a lot of code to basically make an insert for something. And you can kind of think of that as like rows in an Excel sheet. So like, say I had to fill out like 17 rows, or I could just say like, these are what my rows should be. Can you fill it out in this format? And it can write part of that for you, which like I can write the exact same thing, but it can do it in 30 seconds, or I can do it in 30 minutes. And so where I found it helpful in a like medical setting, or like when I'm trying to understand research papers and stuff like that, I found it helpful to like help define terms for me. Yeah. But then it's also in the like, normally I'm doing Google searches on like something that I don't understand. Like I'll do a Google search on it and then I'll have to like see if I can find anything that's even remotely close to answering my question. But what I really like about ChatGPT is it can like teach you. So like what I end up doing is I'll ask a question and it will give me the answer, but that usually prompts another question. And so I can say like, oh, so does this mean X? And it will either correct me or it will like teach me more about it, which I think can make it a great learning tool in that respect.
And I have also asked it a medical question, and then it'll give me an answer. And then I will say, can you explain that to me in 2nd grade language?
Yeah.
And then again, I don't really know if the translation, I don't really know if it's, correct or not, but I think it's pretty fascinating that it can do things like that.
Yeah.
I actually want to try to use it more in my like day-to-day life. And then I have not explored at all how to use it in work. We'll actually, I think we have this on our list to talk about ways that doctors are sort of using it. And then I feel like there's ways that individual doctors might be playing around with it to improve their clinical workflows or things like that. And then of course, there's going to be a whole set of commercial products that come out of things like this that are going to be around and advertised and available for people. And there's a lot of writing about that as well. Katie, by the way, I will link your, I was just looking again at your thread that you tweeted about this. Some of the responses. So I'll link that so people can see. And then also the study, which I think is a fascinating study. I just wanted to point out something really quick, which I think is hilarious. Like that study The doctors did very poorly compared to the chat GPT, or I keep getting it wrong. Sorry. Whatever it is, the acronym. GPT. Yeah. So just for people that haven't read it in detail, I think a lot of people have heard about this at this point because it did make a lot of news, and it's in JAMA Internal Medicine, which is a pretty widely read journal. And just like they looked at basically empathy, and then like if the patients sort of liked the responses, I guess. I'm not, this is not a journal club. I didn't read it in great detail, or whether they thought that the response was acceptable, I think is the term that they used. And like on the empathy category, for example, the patients rated the chatbot as being empathetic or very empathetic, like almost 50% of the time. And doctors weren't even 5%, which is just, and one thing I did want to point out is I think that a lot of that actually comes from things that we already know. Katie, your experience with Reddit around the time of your diagnosis, I think is pretty well documented. Like you have that out there. We should link to that as well, because I remember when we first met and we were talking, I looked at a lot of your content, and that was one that was really striking, because I understand where those doctors are coming from, but like every time I'm like, why would you say that? Because I feel like you have to always realize that if you're so definitive with your answers in medicine, like you're going to get burned once in a while, because biology doesn't care. It just does what it does. It doesn't follow the rules. But I think what people were sort of hovering around is the idea that there is really well documented and known discrimination in medicine in the way that patients present. So 2 easy examples is that we know that there's racial disparities in the way that pain is managed. Like this is like well studied and well documented. We can link a couple papers if people want. And then same thing with women who present to emergency rooms and the way that pain is managed, and like different types of pain. The classic medical school thing that I was taught was like, for decades, women would come in with chest pain and people would think, oh, women can't have heart attacks. That's like a men's thing. And this was like way back in the day. And so I was taught like never discount chest pain in a woman that comes into the ER, because you should always check and make sure that you don't miss, a cardiac event in someone. And so I think I'm not giving those as examples that I think are going to be fixed by this software, but I think that like where people are butting up against the problems are we're starting to emphasize some of the stuff that we've already known and haven't really addressed so well in medicine, with some of these disparities and the discrimination that does happen in the way people present.
Yeah.
Oh, go ahead.
I was just going to say that thread for Ask Docs, like when I went back and read it, like I understand why they said those things, because I understand the context, right? And I understand that like my scenario and the rareness of it and everything like that. But I think it's interesting because I think it kind of is twofold. I think there's way more than 2 things that go into why those responses are the way that they are. But I think like physicians as well, like there's physician burnout is very real, right? Like that's something that people talk about a lot. And I think sometimes the empathy might come out of that when like you're just trying to write a direct response. Like maybe there isn't the empathy shared on the other side for that. And that's why a lot of those responses are lacking them. But also, I also think it's just like hard to be verbose in those platforms. Like they could have written a really, really long response to me that like was very empathetic, but it probably would have been twice as long. Which, I mean, I think they also thought that they were being empathetic too. So I think there might be a difference in how it's perceived, because when I think of like, they were telling me like, I should probably look into therapy. And I think were thinking that they were trying to help me. Like, this is somebody who's like really mentally suffering. Let me help them by telling them they should go to therapy or look into therapy. Whereas me, as somebody who had kind of been getting that response over and over for the last year and a half, I was like, stop telling me to go to therapy. There is something wrong. And so like, I think it's even shown in that thread when I followed up, like I even followed up and said, hey, this was cancer, because I wanted that thread to have a resolution. And they didn't believe me, actually. There was one that said the response when I said it was cancer, the doctor that had told me to go to therapy had responded, okay, I'm sorry to hear that, but I did answer your question. High platelets does not always mean cancer. And then somebody else replied and said, like, there's no way that your presentation ends up being cancer or something like that. I can't remember exactly what it was, but
there's always a way. All right. That's the lesson. I mean, honestly, it's like, maybe this is just because when I first started practicing, I was a sarcoma specialist, and sarcoma is like the most ridiculous, like, it does whatever. And there's like a million different types, and there's not a lot of patterns to pick up on for the most part. And so you learn very quickly that if you make definitive statements, you're going to have a patient come back and tell you that you were wrong. And so these days I'm a lot kind of softer with statements that I'll make. The other thing that, just to point out, is that I think there are questions that we don't know the answer. And I think sometimes doctors don't like to say that, but like just yesterday, I had a patient that, we talked for a long time, and eventually it became clear that they were just worried about recurrence, right? Which we should probably do a show on this. This is a well-documented thing that most patients worry about, and it's probably one of the top issues. I think the UK even did a survey of patients with sarcoma, and they showed that it was the top issue after patients were done with treatment, is just constant worry about and anxiety about recurrence. And I just said, look, like, I can't predict the future. I don't have an answer for you. And I tried to offer resources to kind of support working through that worry. And then I also try to like validate that it's a common thing, that's not unusual to be worried about that, but that's not going to fix the problem that they want me to fix. Right. And so I think that there are going to be times where maybe it gets into like the chat bot will like give you a weird answer, try to fix it, and it just ends up being a bad answer because we just don't have a good one. Right. Or I don't know.
I think that'll be interesting. Like, I think we are going to do a rapid fire like question type thing at the end. That I have one that it might give some of that, but like so for me, I mean, I am a patient that worries about reoccurrence all the time, right? Like, I think that's pretty common for people to worry about. And I've asked all those questions. Nobody has the answers for me, right? And ChatGPT is not going to have my answers either. But in those scenarios, when I'm asking those questions to a physician, I'm looking for, like, tell me percentages, or like, let me know kind of what information that does exist. And I think what sometimes gets lost in communication there is like, there's some knowledge that I think you as a physician have and know, and like let you know kind of where your comfort level is with a patient on surveillance or whatever they're on. But I don't think that always gets communicated back to the patient. And there's not enough time for you to communicate all of that knowledge, right? So I think that is something that, like, in some of those scenarios, I don't think ChatGPT that is there now currently at all, because the data is too old. Like, it's pulling from 2021. And so it's not going to have up-to-date information. But being able to help people understand the context, like, maybe if you have early stage disease and you have like a 90% chance of like staying in remission or it never coming back, then like you have some of those stats and understand why, like, where your doctor says, I'm not worried about it, you're fine, you're cured. You can understand the details behind like why they might be saying those things.
The other thing that's really just important to point out is I think that the best doctors are ones who pay attention to the body language and the reaction to when you say things to patients, because one of the most challenging things that I find is that patients are very different in how they want to receive information, right? There are certain patients that they never want a number. And if you give them one, it's going to ruin the relationship. And so you try to pick up on that. And that's something that, it's kind of like, these AI tools can do so many things, but I think we're so far away from things like self-driving, because it's just like driving is just chaos, right? And there's so many variables and so many things to process. I think that people forget that we do so many things quickly when we're interacting with each other that like computers can't do. And so that's why I was so surprised to hear the empathy results from that study, because they wouldn't expect a computer to be more empathetic than the doctor, but that's what they said. Do we want to do this thing where I was going to go up against ChatGPT? So the concept was, I don't know if it panned out this way, right? But I think what we talked about was that we were going to pretend it was 3 a.m, because we started this discussion by people like, or both of you, I mean, they basically have asked it questions, or these are questions that you ask when you're obviously not sitting in the doctor's office, but 3 a.m. is nice because you're just by yourself and there's no one to really reach out to. And then the analogy for me would be like doctors do take call. Radiation oncology is a little unique in that we take kind of call sort of outside a clinic, and we usually cover it, or sometimes there's an answering service. But you, as like a resident, for example, I would get calls at 3 a.m. from patients, and sometimes they were emergencies and sometimes they were just questions. I think once I even got one that was like a scheduling question at 3 a.m. and I was like, why are you worrying about the schedule at 3 a.m? But basically the goal here was to try to compare questions and answers, right? I was going to try to fight the chat bot, see if I could do a better job than the people in the study, maybe.
It's Matt versus chat.
Right.
Let's
Matt
do it.
versus chat. I love that.
So did you, how are we going to do this? Do you want me to just like try to answer and then we'll see what they say and we can kind of talk about the response that.
Yeah.
Do you have it open, Katie?
I do. And I'm typing my very first question in there. So I'll let it populate some of the answer here while I ask you, Matt, the question, and then we'll see what it is. So, all right. So my question, and this came up in the context of like, I've always been like, whenever I was on treatment, I was always worried about my liver, and especially even after surgery and everything we did to my liver, I had elevated liver enzymes. And I was trying to figure out like why my doctors weren't concerned and why they were elevated and out of range. Like what's a concerning range? So my question is, what are the ranges for elevated liver function tests, and what is a concerning number? Or like when is it concerning? Like, yeah, I guess that's like what's concerning? What's an emergency and what's not?
Yeah. No, I like this. This is good. So I'm actually going to open my computer because I think it's the ranges. I'll admit that I don't memorize them.
Yeah.
And actually, I just had this discussion the other day with a patient. I like to emphasize to patients that ranges to some extent are actually set on an institutional basis. Did you guys know that like
Yeah.
you guys both go to different cancer centers? Julie, your normal could actually be different than Katie's normal, and that's actually set by the labs at the cancer centers or at the hospital. Wherever you go, it's set by the lab or some regulatory body associated with the organization that kind of sets those values. And so I do like to emphasize that to patients because this comes up a lot when people are 0.1 over the normal or 1 over the normal. And I just say, if you went down the street, it might actually be normal. Anyway, so my ranges that I have at my center are for, are we talking about the liver labs, AST and ALT? Is that?
Yeah. I mean, I was looking at AST, ALT, ALP, and bilirubin is the ones that I usually look at. But
yeah. And so for context, just so people know, AST is aspartate aminotransferase. I'm reading this. I'm not memorizing these things. ALT, it doesn't give me the thing. I forgot what it stands for, but it's another. Those are 2 proteins inside the liver cells that play a role in liver metabolism. You were going to say what the answer was, Katie, right?
ALT. Did you say ALP or AST?
ALT is the one I don't have the.
Oh, align tras. I can't say these things. So trazamine.
Yeah, we should post it in the show notes. But basically,
okay, I completely butchered that.
Yeah, alkaline phosphatase or ALP. That's what sometimes people abbreviate as ALP. That one is another enzyme that is in the liver, but it's also elsewhere in the body, like the bones too, for example. And then the bilirubin is actually a pigment, or it's a molecule that your body makes to help digest food. And so the liver, it makes it and then dispenses it into the bowels. And if things are blocked or damaged in the liver, it can rise in your blood. And so that's what we sort of look at. And so all those values are basically molecules in the liver that talk about liver damage. And so what I tell patients is you need the context here. So for example, if you called me up at 3 a.m. and you told me I got labs yesterday. And then, by the way, the day before the labs, I went to a bachelorette party and had 7 shots of vodka. And so that might actually raise your ALT and AST a little bit above normal. And if you just took blood from any person, that it might actually be slightly above normal, and then it would return back to normal within a few days or a week or so. And that's actually not a concern. If you called me and you were on chemotherapy and you were having symptoms suggestive of liver problems, like your skin was yellow or you were nauseous or having diarrhea or things like that, and then we looked at your labs and they were really elevated, that would make me very nervous. And so I'd probably tell you to call the medical oncologist and try to get a hold of their on-call doctor and kind of talk about that really quickly. And so I think it's all about the context, and I'd ask you a number of questions about how you're feeling, because if it's asymptomatic rise, in other words, if you have no symptoms and it rises a little, it's usually, not always, but usually something that's not as much of a concern. It can kind of be dealt with at your next visit or things like that. Doesn't need to be dealt with at kind of 3 a.m. So I don't know. Was that the question? What you asked me what the range?
Yeah, it was basically the context behind that. So like, if we're talking about, like, I think when we talked about how these questions came up, like, these are things that, like, I've Googled at like 3 a.m. Trying to figure out. So like, that is, so my exact scenario is probably like, I mean, it's happened a number of times, but like my bilirubin was probably, I had ALP that was really high for a long time. And then I had, my bilirubin was like 1.2 and then 1.4. And I was trying to figure out, like, what is a concerning level? Like, nobody's concerned yet. When will we be concerned?
Yeah.
Kind of thing.
Yeah. And I think, just really quick, I think the context is really what matters a ton, right? I mean, I would tell you that a normal bilirubin caps out at probably like 1.2, 1.3, 1.5, something like that. So if you show up with 10, like, everyone's concerned always, no matter what, and you're going to have symptoms and things like that. But at a level of 1.5, 1.7, it literally could just mean that your liver is maybe a little irritated from a medication or from something that people are on, or from the tumors that are there, something like that. And so all of those things may not reflect a drastic change. And so you may not have to, it may not be an emergency, if that makes sense.
So that's the exact context that I was usually looking for, was you gave a piece of like 10, like 10 is like a severe number, or like a concerning number. Like, I think as a patient, a lot of times there's absolutely zero context to like what these ranges end up being. And so I'll switch over to the answer that ChatGPT gave me to give you an example of kind of what was the information that I was kind of looking for there.
My answer was not very good, I think. So let's see what the chatbot said.
So I asked it, what are the ranges for elevated liver function tests? And it basically said, liver function tests measure a number of enzymes and protein in your blood that are produced by the liver. Different labs may use different ranges for what's considered normal. Here are the guidelines for the normal, abnormal levels for some of the most common function tests. And it's ALT, AST, ALP, and GGT, bilirubin, and albumin. Did I say that right?
Yeah.
So bad at pronouncing anything medically. And it gave me those ranges, but I didn't like the way that it presented them. So I said, can you make a chart for me in those ranges? So then it built those into a chart for me. And so it had a normal range of 7 to 55 for ALT, and an elevated over 55, and gave me a bunch of information. And so those are ranges that I can just see in my chart, essentially. Like, I would be able to see that I'm out of the range if you're like over 1.2 for a bilirubin, for example. So when I said, like, the value of where I find this stuff helpful is like, okay, I need an answer beyond that. So I said, what are the ranges concerning for intervention? Can you make me a chart at what levels are concerning for intervention? And then basically it gave me a definition of concerning levels is like 3 times the upper normal limit. So for example, for like ALT, for example, so if I had a concerning lab that came back at like 55 for my ALT, which would be an elevated level, as a patient, when you see that in my chart, you might think like, oh no, like, am I going to be having to stop treatment because I'm like 1 over? And so the context here of knowing, okay, it would be about 165 is like when you're starting to, I don't even know if that is like when you would actually consider intervening based on your answer, Matt. But
well, that's where it gets really challenging, because I think like you're a relatively advanced knowledge patient, right? And so when you start to get into these questions, like asking specifically for you, you're very rarely do doctors take a single lab value or a single set of labs to make a clinical decision. It usually involves the context, other labs, and then the consequences of what your decision is going to be. Like we always think the next step ahead, like, well, what happens if we do this, right?
mm-hmm.
And so I think that's where like the advancement's going to have to go way forward, I think, to make it really useful in the way that we're talking about. Because like, I mean, it's probably true that if you have normal liver labs and then they go 3 times above normal, your doctor is going to do something about it, because we don't just leave that. But it might be expected in some cases. And then in that case, we wouldn't do anything about it. Or if we have a clear explanation that doesn't require an intervention, that kind of thing.
I don't think we should include this example here. I have other examples. Like I was just thinking through that of like, sorry. Cat was like trying to knock over my guitar apparently. That I think gets more into personal situations. And so like I've asked those questions from like what I'm really trying to get out of those questions at the end of the day is I'm trying to figure out like, can I go back to sleep or is this an emergency? And so the context that I feel like that gives me is this emergency? Is this an emergency or not? What does an emergency actually look like? To be able to help identify what that might be. I don't think like
that's how I use it too.
Is a good example. I think we should not include that version. But Julie, maybe if you have a different question.
Well, I think I use it in the same way. I ask it questions when I'm not sure, like if I should take an action because of what I'm experiencing. So my most recent example is I woke up in the middle of the night a few weeks ago with the most excruciating neck pain I've ever had. It didn't feel anything like you just slept on your neck wrong. Like I could not move my neck. And so I remember I woke my husband up and the first thing I said was, I have a tumor I have a tumor somewhere back here. I know it because in my mind, like in my 3 a.m. mind, nothing would hurt like that except a tumor, which I've had tumors and none of them have ever hurt. So anyway, so the question that I asked was, what do bone mets feel like?
That was one of mine.
That was my question. And then the next question I asked it after it answered that was, when should someone go to the ER for cancer-related pain? Those were my most recent 3 a.m. questions.
I'd be really curious to hear the answer to the second question. Am I supposed to answer first and then we can?
Yeah, if you can. But I also know you have a hard stop, don't you?
Well, it was. I guess it's a soft stop. But yeah, I will be. Let me see. Yeah, I mean, I'm guessing that I'll be called very shortly to go to clinic. But I can try to answer them real quick and see if.
Okay, so try to answer real quick. What does pain from bone mets feel like?
Yeah, this is common. So I often will tell people a couple of things. So first is I remind all patients with cancer that they are allowed to have other medical problems that everyone else has, like back pain and sciatica and things that lots of people have. And because it comes up very commonly. So common back pain, like, does not necessarily mean that you have bone mets in your back.
Yes.
Yes. But that's something that comes up quite often. So the key for me is things that are constant. So if it like sorry, let me take a step back. So the way that it works is that a tumor will metastasize to a bone and then grow a tumor there. And that hurts because bones on the outside of them have a lining that have nerves in it. And so if they get irritated or stretched, then it starts to hurt. And so basically it's the tumor taking up space in the bone that causes it to hurt, unless there's a fracture or a break. And so what I tell people is that the bone met pain tends to be more constant, meaning that if it's like there in the morning and it goes away after moving around for an hour, like that's probably not a bone met. It's probably something else like arthritis related or something like that. If it gradually worsens over time, so like if 2 weeks ago it wasn't that bad and now it's excruciating and it's kind of been there constantly every day, getting worse and worse, that is definitely concerning for a bone met. There's certain cancers that like often have bone mets. A great example is prostate cancer. There's some cancers that almost never have bone mets. And so, again, almost never, but not always. And so that context does matter, because if someone has a prostate cancer that's very high risk and they have this kind of pain, then you're very worried it's a bone met because it's likely. And so that's another context point. The last thing that I would say is that if it's something, no, I think, that pretty much captures what I tell people, I believe. So I don't know.
I think that's, so I asked it that question again, and I feel like you hit on almost all of the answers. The one thing that ChatGPT did not say was the context around certain cancers may be more likely to metastasize to a bone where others may not. It didn't give me that type of context, but it did talk about sites. There would be site-specific pain and localized pain in the affected bone or bones. It talked about common sites for bone metastases like spine, pelvis, or long bones and ribs. Deep aching or throbbing pain is typically how it's characterized and may worsen with weight-bearing activity. Pain would be present during both sleep and during the day. Progressive pain, more pain with movement, and pain at night is basically what those are the characteristics that it gave me.
I'll often so pain is really tough. And I think that, I think that we don't do a good job of characterizing or even treating it sometimes. And so something that when you talked about localized, one thing I'll often do is I'll just walk in the room and I'll say, can you point to it? And if someone they point to it with one finger and they point exactly where it is, and you look at their scan and there's a spot there, like that's like that is very classic for that. If it's like, oh, my whole arm hurts, that's still possible, but it's just a little less likely. So I think all the things you mentioned are classic things that you would teach like an early medical student to try to differentiate what's happening with pain. There's actually an old, I should put this on our show notes, but there's a couple of acronyms that we learn about asking about pain that help give you a sense of what it is. And it's the one that I learned is called old CARTS. It's like I don't even remember what the acronym's for anymore, but it's like the location, the duration is like in the onset. And then there's like aggravating factors. Like you said, with weight bearing, that's something else that would kind of clue us in and let us know about what needs to be done about it. So I'm actually doing okay. I don't know how empathetic it is, but sounds like I'm getting the information correctly.
I actually would prefer your answer, Matt. So I thought it was interesting that was your question, Julie, because that is probably the number one thing I have Googled at 3 a.m. is what bone mets feel like. And I've done it over and over and over and over again because I'll get just like some random pain. And the one that I would always get is that it's like more common at night, like that you would feel it more at night is the thing that I've received in a lot of my responses. But what I liked better about your answer, Matt, is the fact that like you explained why the pain happens, because it's like the nerve endings like around the bone. Like that to me helped kind of put some of the context in it for me. And so that answer made it feel like it would be easier to pick up on if it was actually bone met pain, to identify that as different than other pain. But I will also say, I don't think I would ever ask that question to a physician. Like if I was actually having pain that was constant and maybe it was happening during my appointment, I would, but I am never at 3 a.m. going to send a message. Like those are the things that like, as a patient, I'm not going to ask those things because I'm embarrassed by the fact that like, I can't sleep at 3 a.m. because I've got a random pain in my back and I feel like I've got a bone met now. And so that's where I do think that some of these answers are helpful to provide kind of some of that general context. But then at the same time, if I felt like I got a satisfactory answer, I don't know if I'd ever ask it again, but I don't think I'd ask it in the first place.
Yeah.
One thing I do love is how the chat bots do tell people to trust their body and what they're feeling and to always seek more information. I think doctors could do a better job of that. I wish that, like, I think that that's something that I've loved about it. I know it's coming from a place of liability because they don't want to be on the hook if they give someone an answer and it turns out bad or whatever. But I think it's a really good message for patients to hear. I just wanted to throw that in there. Yeah.
Do you want to take a stab at the next one about when should you go to the ER? So the question was, when should I go to the ER for pain that I think is from cancer?
Oh, okay. Can I clarify? So just to clarify, are you asking like, trying to differentiate other pain from cancer pain and whether that?
No, I was just thinking like, well, we can just make the question, when should someone go to the ER for pain?
Yeah. Yeah.
It doesn't really matter that it's cancer or non-cancer.
Yeah, this is a hard one. I guess I would say if, this is a really tough one. I guess I would say that if you feel like the pain is not controlled, and so what I mean by that is if you are at home and in tears, unable to sleep or move or get off the couch or do anything, your family is struggling to try to intervene and you're like not making any progress on it at all, then that would be a reason to go to the ER. Part of why I say that is because there is I would admit that I probably am a little undereducated on pain, meaning that I'm not a pain specialist. These people do exist in cancer centers and they're very helpful. But there's a concept of like a pain crisis, for example. And to me, what that really means, I'm sure there's a good biological explanation, but to me, what it means is that there's a combination of out of control pain, and then also the mental aspect of being able to deal with it is also out of control. And when you get into that situation, there are things that we can do in the emergency room or the hospital that can just sort of just get it under control much faster than trying to do that at home as an outpatient, in part because we can do IV medications, stronger medications, as opposed to just relying on pills, which is essentially what most people can do, only can do at home. And so I would just say that if at any point people feel like they don't know what to do and they can't wait for the morning to talk to the doctor, and or they feel like they're on pain medication pills and they're not helping at all, that would be a reason to go, I would say.
Yeah. So, okay, this is what chat says. Chat basically gives a disclaimer that it's important to reach out to your healthcare provider as soon as possible to get guidance on the appropriate course of action. However, there are certain situations where seeking immediate and medical attention, such as going to the emergency room, may be necessary. And here are some signs that indicate an urgent evaluation. Severe or worsening pain that is not responding to over-the-counter medications or prescribed pain management strategies require immediate attention. Sudden onset of severe pain. If you experience a sudden and intense increase in pain, it could be indicative of a serious complication or an emergency situation. New neurological symptoms, weakness, numbness, changes in coordination, and then signs of infection. So fever, chills, redness, warmth, or swelling around the painful area, difficulty breathing or chest pain, and then uncontrolled bleeding was the last indication. And then it basically says these are just guidelines, and the decision to go to the ER ultimately depends on your symptoms, medical history, and the advice of your healthcare provider. Err on the side of caution, seek immediate medical attention if you have concerns about your pain.
Yeah. It's a little unfair because some of that stuff is not really pain, right? Like, of course, if you're
uncontrolled bleeding, like
I'm going to tell you to go to the ER. But it's a good point because I should have said, I mean, chest pain, like that's that is like, we just talked about at the top of the episode, how we don't really mess around with that. We probably analyze it when it comes in for a lot of people, but chest pain is like something where if you're not sure, you should just go in. And I would say the same thing to patients, same thing with like neurologic symptoms, but I don't know that pain is technically a neurologic symptom, but the other things you mentioned are sort of outside that scope.
Yeah.
But that's a much more complete answer. I love, though, I wish I could be like, but you should probably call a different doctor to verify what I'm saying, because I think it's kind of funny that it sort of cops out like at the beginning like that. But it is really important. One point just to make really quick on this topic, we'll have to talk about it some other time, is it is a struggle, because you probably both know that going to the ER is like not a great experience. And it seems to be ever worse, especially like post-COVID. It seems to be like the waits are really long and people can board there for a long time. And it's not like, so I actually struggle quite a bit, because more and more I try to see if we can manage things at home, but you don't want to be the person that keeps an emergency or keeps people from emergency care when they're having an emergency. So it is a little bit of a challenge. The additional layer that makes it harder is there's actually growing data that, if a patient with cancer goes to the ER, they're overwhelmingly likely to be admitted to the hospital. And then once they're admitted to the hospital, they're at risk for complications that wouldn't have happened if they weren't admitted to the hospital. And so those are always something that's kind of in the back of my mind and I'm trying to think about but anyway, I like their answer. I'm going to be more comprehensive with the ones that I give. So
I think it was good to go back and forth and to see the answers between two. I think, should we give some like final parting, like overall summary of like our thoughts on it from a high level, and then like any words of caution for using it? I can kick us off there.
I'm curious. Can I give mine really quick, because it's very short, and I'm curious to hear yours. Mine is I would encourage its use. I really would. I know that there's been some discussion, and I know there are people that don't like that answer, but I view it as like a souped up Google, and I love when patients research things and then come in. But that being said, like, bring the answers to your doctor. Like I think it's great. And I think I had mentioned even offline or something when we were talking that I think it would be really cool if people brought that in to me, because I think it would spur a lot of conversation and talk about and help facilitate discussion of things that people really want to know. And so I'm a fan of it. I would say that bring it in, but verify everything it says with your doctor, because as we just talked about, it's not always accurate. It makes things up, or it might be misleading, that kind of thing.
Yeah. I think for me, like, I encourage its use with like caution and understanding that it's wrong a lot of time, and just be careful about using it to apply to like your direct kind of medical situation. So like, I would definitely agree with like your advice, Matt, on like, for me, when I think of using this, like, I'm using it in context of like, I need that additional context so I can know kind of the whole, like, kind of the bone mets thing, right? Like, can I go back to sleep because I can kind of put my mind to ease at something with like this, that I may not feel like I wouldn't ever send that message to my doctor or something like that. And I think that it can be used as long as it's like, I think it's really good in those situations of like just providing general information. I think once you start getting into specifics, that's where I think that it just needs to be verified. I think people are going to use this just like they'll use Google and everything else. And I use this outside of even medically. I use it personally more than I use Google now. And so, but I think it's really important I verify half the stuff I get from it through Google. So I think it's a great resource, and just understanding its limitations is like the biggest thing that I think is really, really important for people to know, is to just not blindly trust it. Use it as a tool, not as like your sole guidance.
Yeah, I mean, I would agree. I think it's here. I think people are using it. I think people are only going to continue to use it. I think people just need to understand the best ways to use it, the risks and benefits of doing so. I think, I'm excited for like how this could potentially help patients as they try to become a more educated and aware patient. I mean, we've even talked about some of the struggles and things like finding clinical trials. And so I can just only imagine like how helpful it could be if you have this model that can cull down a bunch of different data sets and can help like weed through things that then you could take forward for evaluation, and how it could save someone immense time, like sifting through a bunch of information. I mean, granted, it can also be wrong, so there's caution there, but I think in time, I think this will be an amazing resource for patients.
I agree. Yeah.
Yeah.
Oh, they're gonna
Yeah.
call me. So I gotta jump off. This was great. I think we can definitely make some edits, but I think this is good, and I think it was a great discussion. And I think the whole time I've been thinking about how I think it'd be fascinating to have a discussion with the doctors as well about this, and just kind of see what people's thoughts are there. Because like you said, it's here, like it's not going to go away. So it's about making sure that we are using it in the right way and making it most beneficial for patients, I think.
Maybe we can do a follow-up episode where we just do we'll figure out better questions to ask, but like bring another doctor on to have kind of those discussions and some of those questions around it, to hear that perspective, like alongside with yours, Matt.
Yeah. Have fun. I'm excited to talk after. I'm really looking forward to hearing your thoughts. I mean, obviously text during the thing, but yeah. So.
Yeah. Bummed we're gonna miss you there.
I know. Well, yeah.
Next year.
Yes.
See you later.
All right. Bye, everybody.